Assalamu alaikum. I'm Dr. Sehrish Zaffar and I welcome you to Key to Pharmacology. In this video, we are going to discuss the details of pharmacotherapy that is required for the treatment of chronic obstructive pulmonary disease. If you want to get a command on this subject, all you have to do is keep watching till the end. COPD or chronic obstructive pulmonary disease होता क्या है? Basically, there is obstruction to the airflow. ये obstruction क्यों हो रही होती है? Because of certain damages to the air passages जो कि irreversible होते हैं. Alveolar damage हो जाते हैं, bronchiolar tissue damage हो जाता है, जिसकी वजह से irreversibly जो आपका air passage, air flow है वो disturb हो जाता है. It presents as persistent symptoms of cough, excessive mucus production, chest tightness, excessive shortness of breath, and difficulty in sleeping, which is often accompanied by fatigue. Pathophysiologically, COPD involves permanent structural damage to the alveolar cells and the parenchymal tissue that results in decreased breathing efficiency, which is further exacerbated जब कोई respiratory infection हो जाए. Also, in these patients, the respiratory infections are very common. Upper respiratory infection repeatedly triggers and worsens the chronic obstructive pulmonary disease. The reason being, in a patient who has COPD, there is damage to the airways, the breathing is already impaired, और excessive mucus production हो रही होती है which provides a very strong medium जिसके अंदर बैक्टीरिया ग्रो करें, बिकॉज म्यूकस वहाँ इकट्ठा हो रहा होता है, वो सिक्रीशंस रिमूव नहीं हो रही होती हैं. इट बिकम्स अ कल्चर मीडियम फॉर द बैक्टीरिया वेयर दे ग्रो, दे थ्राइव एंड दे रिपीटेडली कॉज रेस्पिरेटरी इन्फेक्शंस. पेशेंट्स विद COPD have worsenings with each infection, and that is why while treating COPD it is equally important कि आप उसको antibiotic treatment भी दें. One of the differences between COPD and asthma is that COPD is not as responsive to bronchodilators as asthma. Having said that, ऐसा नहीं है कि bronchodilators काम नहीं करते. Bronchodilators are the mainstay of therapy in COPD as well, but जो prompt relief आपको मिलता है bronchospasm का in asthma, वो आपको COPD में नहीं मिलता. Drugs that are used for the treatment of COPD can be broadly classified into bronchodilators, anti-inflammatory drugs, including steroids, and antibiotics. Bronchodilators, especially the inhaled bronchodilators, are the mainstay of treatment for COPD. This includes beta-2 agonists and muscarinic antagonists. They are going to help in increasing the airflow. They are going to cause bronchodilation, जिसकी वजह से जो exacerbations हैं airway obstruction की वो decrease कर जाएंगी. The long-acting bronchodilators हैं such as long-acting beta agonist or long-acting muscarinic agonist. They are the preferred treatment for the COPD because COPD में asthma की तरह कोई acute bronchospastic stage नहीं होती है जिसको एकदम से ठीक किया जाए. There are stages of exacerbation which result in acute bronchospasm, which can be prevented अगर एक patient को आप chronically लॉन्ग एक्टिंग बीटा-2 agonist या फिर muscarinic antagonist देते रहें. There are certain patients who are going to tolerate the muscarinic antagonists better in COPD as compared to the beta agonist. क्यों? Beta agonist selective भी हो beta-2 agonist, though there is some level of cardiac stimulation and palpitations. Now COPD patients are often have heart disease as well, जिसकी वजह से these palpitations worsen their heart symptoms. As a result, beta agonists are not very well tolerated या फिर उनके अगेंस्ट पे compliance poor होना शुरू हो जाती है. So muscarinic antagonists are often preferred in this case. Corticosteroids are used in a patient of COPD only in case of acute exacerbation. बहुत severity के साथ present किया है. Inflammation is the main issue that you want to resolve in order for the lungs to clear out and have a breathing space, तो आप उस वक्त के लिए corticosteroids देंगे. Unlike asthma, हम कोई chronic prophylactic steroid treatment COPD में नहीं देंगे because it can cause increased risk of pneumonias and respiratory infections. A new drug, roflumilast. It is an oral phosphodiesterase 4 inhibitor that has been specifically approved for the treatment of COPD. Now roflumilast, because it is a phosphodiesterase 4 inhibitor, It is not a bronchodilator. Rather, it is an anti-inflammatory drug. ये exacerbations को prevent करता है, severe chronic bronchitis को prevent करता है. It reduces inflammation by decreasing cyclic AMP in the cells, and anti-inflammatory role is the major role that results in decreased exacerbations of the disease. Since it is not a bronchodilator, it is not recommended for treatment or relief of acute bronchospasm. Lastly, antibiotics are extremely important in a patient of chronic obstructive pulmonary disease, because every time an exacerbation occurs, the underlying cause most probably is a respiratory infection that has to be treated for the COPD to improve. Antibiotics are recommended whenever there is an acute exacerbation, but certain studies show that even if you give continuous low dose of antibiotic, even that can reduce the severity and progression of COPD. Treatment guidelines categorize the patients of COPD into A, B, C, D according to their severity. Group A, being the low severity group with fewer symptoms, is recommended to have short-acting beta agonists or long-acting beta agonists, or short or long-acting muscarinic antagonist, depending upon whichever drug is better tolerated. Because severity ज़्यादा नहीं है, तो उनमें से कोई भी एक ड्रग उनको दी जा सकती है. कैटेगरी बी पेशेंट्स शुड बी गिवन आइदर अ लॉन्ग एक्टिंग बीटा एगोनिस्ट और अ लॉन्ग एक्टिंग मस्कुलिनिक एंटागोनिस्ट. The short actings are not going to be sufficient to control their exacerbations. High risk patients in category C should benefit from long acting muscarinic antagonists, because in such cases the beta 2 agonists are required in doses that are going to cause cardiac stimulation and are not going to be well tolerated. Very high risk patients, category D patients, should benefit from a combination of long-acting muscarinic antagonist with long-acting beta agonists, and if required, if the severity is so high that the inflammation has to be taken into account and decreased in order for the patient to improve, then you can add inhaled corticosteroids very cautiously. This is a recommended first choice regime, जिसके over and above you have to give antibiotics if there is certain infection or exacerbation. I hope this helped you in understanding the pharmacotherapy for chronic obstructive pulmonary disease. If this video helped you, please like, subscribe and share. Thank you.